Jenny Brown's been an NHS midwife for 11 years. She loves her job, but today she'll be joining thousands of other members of the Royal College of Midwives on the picket line for the first time in the organisation's 133-year history.
I cheered on the day when I got the result and then thought, oh, what have I cheered for? And I've just cheered because we're going on strike and none of us want to put the women at risk. I will still be working, I'm hoping to get out on the picket line for about an hour or so, but I know there's lots of my colleagues will be on the picket line.
As well as midwives, ambulance drivers, nurses, hospital porters and other health workers in England will walk out today from 7 AM until 11 AM in a dispute over pay. Strikes will also take place later in Northern Ireland, followed by further non-strike action throughout the week. But the Royal College of Midwives say their strikes will not affect mothers going into labour.
The dispute really isn't with women and their families, it's with the government and employers. So 4 hours is just the start. Thereafterwards, there will be really a range of action which will be taking place on a rolling basis, where midwives will be saying, we're not going to work lots and lots of overtime as they do at the moment. We are going to take our breaks, and if we do work overtime, we will want to be paid for that.
The Department of Health says it can't afford to give all staff the recommended 1% pay rise.
Jeremy Hunt has been quite clear in public that he felt he faced a choice between putting more money into staff or more money into staff pay. Paying everybody 1% increase would have cost around £450 million. That's the equivalent of about 14,000 nurses. And the NHS is facing some of its toughest financial pressures for a generation.
NHS bosses say that non-emergency appointments will be postponed during the strike and emergencies won't get ignored. But ambulance service providers say they may be forced to prioritise their care and are bringing in extra staff from the military to fill in the gaps. Joe Tidy, Sky News.